thank you for the invitation and for the presentation. I'm Carlotta, and the title of my presentation, and this is not the correct slide kit. This is not my slide kit. Thank you very much. And the title of my presentation is Assessing Real-World Prescribing Patterns and Opinions on Antibiotic Resistance. And this is data from a survey, an interesting survey. And we conducted a survey on a convenience sample of European urologists, male European urologists, during several urologist congress meetings in 2018. And we collect data from about 200 international urologists, male European, using a structured questionnaire and validate questionnaire. We aim to describe the management of recurrent urinary tract infection, UTI, in clinical practice. So this is a snapshot of prescription and opinion. And briefly, the characteristic of survey respondents, the distribution by age, the median age was 46 years old, and it was the distribution is quite similar in strata of age, and distribution by country. Mainly clinicians were European, most of them, more than 70% were European, and a few other from the other countries. And for this reason, no analysis in strata by country was performed. So this is the descriptive summary of the answer of each question of our brief survey. How many patients with an episode of lower urinary tract infection do you see in your clinical practice in 1 month? And most clinicians report to visit between 20 and 50 patients per month for lower urinary tract infection. And this is the distribution. So half are in this setting. In your opinion, out of 100 patients affected by UTI, how many patients present a recurrent urinary tract infection in your clinical practice? And most clinicians report that up to 40% of their patients with UTI may present an RUTI. So this is the most frequent answer. But 37% are from 0 to 20%. And when do you usually start antibiotic therapy for the treatment of a RUTI episode? And about the most frequent answer was as soon as possible without waiting for antibiogram culture results, or always after antibiogram test. So the two most frequent answers are these two one. And which of the following antibiotic therapies do you usually prescribe for the management of a RUTI episode? For the management is include acute phase and prophylaxis. So it's a quite management of RUTI episode. For a statistician as me, it was quite difficult to understand what was the most frequent answer, because is very complicated, because there are many answers and many combinations, but we found that the answers were largely heterogeneous. A large number of antibiotic therapies were reported, but we see that most frequent are fosfomycin and amoxicillin and this nitrofurantoin. So this is the most frequent, but it's very, very heterogeneous, the answers. How often have you had to change antibiotic therapy during the treatment of an RUTI episode? And most clinicians report they needed to change antibiotic therapy at least sometimes. So there are some problems with the change antibiotic therapy. Sometimes it's the most frequent answer, but only a few rarely or never. So I have to change antibiotic therapy. And so we ask, do you consider antibiotic resistance a relevant problem in your clinical practice? And we see that the problem of antibiotic resistance is considered relevant but most, if not all, clinicians, and with no difference in strata of age. So this is extremely relevant and quite relevant at the most frequent answer. And in your opinion, what has been the trend of antibiotic resistance in your clinical practice in the last 10 years? And about 17% of clinicians noted a slightly increased trend of antibiotic resistance, and about 20% report a significant increase in trend. Also, this answer, there was no difference in strata of age. Do you prescribe antibiotic for the prophylaxis of UTI in your clinical practice? And 60% answered to prescribe antibiotic for prophylaxis UTI. Do you adopt a non-antibiotic method for prophylaxis of UTI in your clinical practice? Is more frequent, is more than 70% prescribe a non-antibiotic method. And so we ask several questions about, based on your experience, how do you rate the efficacy of this non-antibiotic treatment in UTI management? This slide is full of numbers, quite difficult to understand, but we see that the most frequently prescribed are prophylaxis with cranberry and prophylaxis with probiotics. And when we ask about efficacy, the most frequently considered extremely effective are the most endovesical instillation of hyaluronic acid with and without chondroitin sulfate, and the prophylaxis with probiotics. So this is the most frequent. It's not evidence-based, but was an opinion on experience of this clinician. Then, do you think that you will continue to prescribe or will start to prescribe non-antibiotic treatment for a UTI management in the future? And more than 70% of clinicians reported that they will likely continue to prescribe non-antibiotic therapy for the management of UTI. And other consideration results were similar in strata of age of responders, and several limitations should be considered in the interpretation of these results, mainly because this is a convenient sample and this is not a probabilistic strategy of sampling. So, but it's quite interesting to have a snapshot of a clinical practice in the real world setting. And so the conclusion of this presentation, we see that more than 40% of respondents reported that they start antibiotic therapies for treatment of an UTI episode as soon as possible without waiting for antibiogram and culture results. And changing antibiotic therapy during the treatment of a UTI episode is frequent. And it's good that antibiotic resistance is considered a relevant problem, extremely relevant for 40%. Finally, 17 prescribe antibiotic for the prophylaxis of UTI, and more than 70 prescribe non-antibiotic method for the prophylaxis of UTI, and the most frequent prescribed are cranberry and probiotics. And the most frequent considered extremely effective for prophylaxis are endovesical instillation of hyaluronic acid in combination or not with chondroitin sulfate and probiotics. So finally, more than 70% declare that we will continue to prescribe or will start to prescribe an approach without antibiotics, non-antibiotic treatment for UTI in the future. So this is the end of my presentation. So now we thanks for your attention, and now Professor Kai will start the last presentation of that section. Thank you.
Many thanks,